Now look at diagnostic imaging for osteomyelitis. Diagnostic imaging for osteomyelitis. So diagnostic imaging is more of like somebody has osteomyelitis. So I've done some lab tests and all of that, but this is affecting the bones. Bones are buried deep in. So I want to now do some one or two imagings so that I can be able to, you know, I'm coming. From here I can be able to confirm the extent of the disease. You understand? So what are the various imaging modalities that you can be able to employ for this? That's what we are trying to, look at. Sorry, I'm just trying to do this. So, well, the imaging modality for osteomyelitis are as follows. We have plain radiography. So the first line is because it is the first line because it is what very um, affordable. It is affordable. It is easily available. Almost every hospital you go, you see this. So it dictates bone destruction, periosteal reaction, sequestrum, involucrum. So limitation, changes appear only after 10 to 14 days of infection. So if you early on go and do imaging, you can actually miss it out. Do you understand? You can get a wrong result. Bone destruction, soft tissue swelling, periosteal reaction, a lot of things. All right, so what we got here is this. We also have magnetic resonance imaging, that's MRI. So MRI is actually the gold standard for even early disease that is just starting. So it shows how fluid is accumulating in the bone, shows abscesses, so shows sinus tract, shows soft tissue involvement. They also have high sensitivity and specificity. It's useful in diabetic foot infections and also vertebral osteomyelitis. They will have CT scans as computed tomographies. Let's use computed tomography. So CT scan will give you a better visualization of the what cortical bone changes, also sequestral and also involucrum. Right? It's helpful for surgical planning. They also have nuclear medicine imagings where you can do bone scintigraphy. That's technetium 99M. It will dictate whether there's an increased bone turnover. You have gallium 67, you have indium 111, all of that. PET scan combined with CT scan. Ultrasound, very important in children, can guide aspiration and biopsy. Then like as I'm putting my needle to pick up some tissues, ultrasound is actually guiding me on the screen. So these are the various imaging modalities you might actually want to employ for osteomyelitis.